Very high regular cornea with scarring with RK and dense cataract. And we are always trying to get it to the most accurate mathematics and optics, even with the difficult anatomy and surgery. And like all our patients, there is no anesthesia other than numbing drops. Is that correct, Ali?
Correct.
It's a little strong, but other than that, it's going well.
Lovely. Are you pleased? You're nearly done?
Yes, sir.
Very proud of you. Coming out. Congratulations. All done. How do you feel?
I feel great. Thank you, Dr. Gulani.
How was your experience in this week?
It was calming.
Yes.
Yes.
And I know you were apprehensive with your very complex eye.
Yes.
Doctors, you all saw me go through a very complex radial keratotomy cornea with scars in the front, fuchs dystrophy in the back, very high regular astigmatism, the fear of opening up the cuts, and yet we went and got a very dense cataract out of there and no stitches. Unlike all our patients, there is no drugs, just numbing drops. Any pain?
No pain.
Safe travel. And here she is!
Hey.
Look at her!
Wow.
How's the experience, Ali?
Feels great.
Amazing!
Yes, amazing.
Even with her complex eye, and she was so apprehensive as she traveled here. Yeah, very proud of you.
I have a question. When I lay in the car, do I close my eyes?
Yes. Yes.
But I'm
How was the experience in the suite?
Oh, one. It was great. Thank you.
Pleasure. Come on this way, please. I'm walking through this screen radial keratotomy eye, even though 8 cut, double cut, with fuchs, with corneal irregularity. We are being very careful because I want to come out without a stitch. We have already put in a very precise premium lens with toric astigmatism marks, which are matching exactly the marks on the cornea here, you can see. And that's being as precise as we can with our two-hand technique that I've constantly shown you. And here we are, making sure it stays in place and nice and tight in the bag. Polish. Here we are, and I'm going to talk to the patient while I'm in her eye. And like all our patients, she has traveled. Here we are, completing. I'm finishing up in your eye here. How do you feel?
Okay.
This is your second eye for which you've traveled back.
Yes.
How do you feel overall experience in the suite?
Great.
If a doctor is watching radial keratotomy patient with fuchs and posterior corneal dystrophy with ectasia, where we worked on the lens and did a lens-based LaZrPlastique surgery using a high premium toric lens, you can see exactly on axis right here. And she's come back for her second eye, which we have just completed. How would you describe your overall experience for both eyes before you travel back? I'm all done.
Wonderful.
Congratulations.
Yes.
It's been a pleasure.
I feel that peace with you.
Lovely. You're all done. How do you feel?
I feel great. Yes. Thank you very much.
How was the experience here?
I appreciate it. It was, I didn't feel anything, and I feel at peace. I feel very well.
The doctors watching you saw this patient who's traveled back from her second eye, not only radial keratotomy, but high irregular astigmatism from ectasia and fuchs, and how we worked on her cataract with LaZrPlastique concept and no stitches. She's going to rest, and this is her second eye, right?
Right.
How's our first eye doing?
Oh, obviously wonderful. That's why I'm here for my second eye.
Here she is, second eye done.
Thank you. Yes.
Arlene, how do you feel?
Wonderful. Great. Thank you very much for everything.
That's your pleasure. Again, for doctors watching, you know her complexities. You've seen her first eye with all the radial keratotomy, all the complexities, and she's traveled here for her second eye today, right?
Yep.
Anything you want to say to doctors, I keep on sharing with them.
Oh, you really need to do whatever Dr. Gulani is doing because I feel wonderful as a patient and my eyesight has improved greatly.
How's our first eye doing, the radial keratotomy?
Oh, the first, I'm 20/20 right now.
And this
Yes.
is the second eye, again, as complex. Come on, please, in the hotel, rest as much as you can. Come on, be careful.